Implants I know are something that you do quite a bit of there. What are some of the common challenges that you see patients come in with where dental implants is an appropriate treatment?
So there's a couple of things. As a surgeon, I've received 4 years above and beyond the normal dental education that a general dentist would have received. Uh, a lot of that was in dental implants and bone grafting and preparation of the sites for implants. One thing I see is work that's been done by guys who just haven't been trained to do it. The other thing that I see commonly in our office is patients that have been quoted prices that are just, in my opinion, crazy. Um, we like to provide patients with the most state-of-the-art treatment options. We have everything that we can offer here. We offer teeth in a day. There's lots of commercials on the TV and radio now talking about that. We offer that same service for about $5,000 to $10,000 less than some of the corporate places. We can do immediate implants, which means we take the tooth out and place the implant on the same day. Not always is that possible. Sometimes we'll have to go back in and do bone grafting. We can do advanced bone grafting techniques where we take bone from your own body and place it. We can use bone from cadaver sources and synthetic bone, just depending on what the patient feels comfortable with, and rebuild a lot of sites too that otherwise, a general dentist might look at and say, oh, there's no way we can place an implant in that site. There's not enough bone. Maybe we should do a bridge or something of that nature. Whereas as a surgeon, I look at it and say, hey, no, we can recuperate this site and then come back and place an implant secondarily.
So it sounds like what you're saying is a lot of I know that the trend is for a lot of general dentists now to do dental implants, but it sounds like what you're saying is that it probably is worth seeking out the recommendation of an oral surgeon, if nothing else, at least as a second opinion before you do with an implant case.
Yeah, for sure. There are a lot of guys who are very capable of placing implants, so that's certainly not what I'm saying, but at the same point in time, if you ever have a question about something or if it's a difficult procedure, certainly I would seek out specialist care. A lot of these guys, as I stated, I have some good friends that place a lot of dental implants and do a good job, but these are the same friends that are going to send the difficult cases to me because they understand that they're above and beyond their comfort zone. And so if you have a question as to, is this appropriate care, is this really what should be being done, certainly seek out a second opinion from a specialist. People are worried that when they come to a specialist, we're going to, jack them up in the price and things in that nature, and you'd be surprised. I find that my implant prices at times are cheaper than the general dentist prices. And a lot of that just has to do with my comfort level in placing the implants and the volume of implants that we place, so I can get a little bit better deal on the purchase price of the implants and things of that nature.
So what type of challenges or what do you most commonly see for dental implant cases in terms of challenges people are having?
So typically the dental implants that are being sent to me are specifically sites that don't have enough bone or anatomical relationship to the nerves or adjacent tooth structures are such that the general dentist doesn't feel comfortable doing that implant. And so, lots of times we have to have discussions about bone grafting. We have to have discussions about site preparation, whether that be soft tissue grafts and hard tissue grafts. We'll have discussions about appropriate treatment intervals. Typically, as we place implants, if I have good bone, I can place an implant, and depending on the implant we're using to restore, we can restore that as early as 2 weeks after the implant placement. Now, when I say restore, that means putting on the final crown so that you have a tooth that you can chew on and function on. But not always is that the case. As stated, many times we have to add bone, whether it's a sinus lift or a site augmentation, and implant cases can draw out to 8 months to a year depending on what we're doing. And that's probably the biggest thing I see in my office is inadequate bone. And so we're having to do bone augmentation and recuperate a site to allow for implants to be placed. We also see a lot of teeth that the tooth's in place and the patient wants the implant placed the day that we take the tooth out. It's called an immediate implant placement. And again, that cone beam CT scanner helps us a lot with that because we can evaluate the bone surrounding the tooth and below the tooth or above the tooth and allow myself to know, hey, is this something that we're capable of doing? Is this something that can occur? Or do we need to do that socket preservation, the bone grafting, and come back later on and place the implant?